My name is Mirson. I'm a fourth year medical student here at Pitt.
Obviously, like PreMed is such a popular track, especially here at Pitt. So what would you say to people who don't know if PreMed is sort of like the right track for them? You know, what was there a specific moment for you, like a watershed moment you'd say, or was it more of a culmination of things that made you decide like PreMed is the right path for you?
Yeah, so that's a tough question to answer. I would say for me it's probably more the culmination of things. I mean, I was an engineering major at Pitt for my undergrad.
Yeah.
And I kind of knew I wanted to do medicine. I think going into college I wasn't 100% sure. I decided to explore engineering because I really liked math and physics back in high school. And it was, it was a good job market. But ultimately, as I found, like going through the years, I liked the engineering coursework, but I didn't love it.
So you were more like, in terms of bioengineering, you were more like the bio side.
Yeah, I was very
cellular track.
Yeah, I was the cellular track. Yeah. It's just that I found that I would miss working with people a lot, and the classes that I took, particularly physiology, I took honors phys with Gates, which I would highly recommend to anyone. And honestly, that one class like absolutely swayed me. I was pretty confident I was going to do med school by that point, but at the end of the day, just the working with people aspect of it, and I just really like medicine a lot, and I never felt that strongly about engineering.
Yeah. Because a lot of people I know, like they'll have like this sort of self-doubt of like whether like, because it is a rigorous process. You know, you're in school for so many years.
Right.
You know, is this sort of the right path? Is there like any sort of like questions you would say you need to like ask yourself internally if like this is med school you'd say is like the right path for you?
I would say if you're debating between med school and something else, you should really take some time to do something else first. Yeah. Because once you're in med school, you're committed. I mean, you're taking out loans that are going to be difficult to pay back on salaries that are not physician salaries. Yeah. And I mean, it's a lot of hard work. Like you said, the training is very long. So now, especially now, it's much more popular to be taking time off, doing gap years, exploring other careers. I would say at least half my classmates come from like either one to several gap years. Some of them come after doing a whole nother career. So don't feel pressured to go into medicine right out of college. Like if you can't see yourself doing anything else, then that's a perfectly good reason to do medicine. If you think that there's other options you'd like to explore, take that time to explore it because you won't get another chance to do that.
Going off of that actually about gap years, so like it's becoming increasingly popular to take a gap year. Like especially like after senior year, whether it's just to take a year to decompress or really just like bolster their med school application. So obviously you didn't personally, right? You didn't take a gap year. What do you think of sort of like the pros and cons and why you didn't specifically choose to take a gap year?
Yeah, so I think the big pros for a gap year is, like I was saying, it gives you time to figure out if there's something else you're interested in. It gives you time to explore things that you won't be able to do when you're in med school. So some of my classmates, for instance, did like missions trip abroad. Like like one of my good friends, she spent 2 years in Honduras teaching English. It was a great experience for her. She loved it. You would never get to do that.
That's not really possible.
You would absolutely not get to do that if you go to med school or out of track. Similarly, if you have a research project that you're interested in pursuing, you can certainly do that in med school, but right now you have the time to really focus in on it and do it justice. So that's a perfectly good reason. Sometimes people need to do a post-bac if their GPA isn't what it needs to be to get into med school. Also a very good reason. So there's a number of good reasons to do gap years. There isn't many bad reasons. I generally encourage people to take a gap year if they want to. A bad reason to do a gap year is sitting at home watching Netflix. That's a bad reason, right? I would say from being on the other end of interviews, like when I'm interviewing applicants for medical school, generally the people who do gap years are more interesting than people who don't.
Just having more years on your
you just have more experience. You've seen life outside of college, which is its own universe. But you've kind of grown, I think, a lot as a person in that year or two. And like you said, I mean, it's becoming so popular. It's generally it's advantageous. Just whatever you do with your gap year, make sure it's something that's productive and something that's worth it. And generally, people do that.
In terms of like the MCAT, so obviously that's like a pretty like daunting task that students see as sort of like a roadblock between them and med school.
Right.
How did you go about studying for the MCAT, and especially with respect to balancing that with your undergrad coursework?
Yeah, so I believe I was the last year of the old MCAT. So I took mine in 2014, which would be the summer after my sophomore year, which is a little earlier, I think, than generally most people take it.
Yeah.
At that time, the MCAT just consisted of a verbal section, a physics, chem section, and I think a biology section. It's been a while, but I think it was just 3 sections at that time. And the thing is, being a bio-E, I had already taken all the physics, chem, biology that I needed, and I could read, so that's good. So I was able to take that the summer after my sophomore year. The reason I chose to do that was because then I knew I wanted to apply the summer after my junior year, and I didn't want to be thinking about studying for the MCAT during that time period. So I studied for it instead during the summer of my sophomore year, and I took it then. Now I know the MCAT has expanded since then, so I think that might be more difficult because there's more requirements now for you to know. Generally, I would recommend taking it in the spring or maybe early summer at the latest of your junior year if you plan on applying that cycle. Because you want the scores back before you apply. In fact, I think you might need to have them back before you apply. And the biggest mistake that pre-meds make in applying to med school is applying late. So whatever you need to do to get that MCAT score early before you're you're ready to apply, that's what you need to do. Now, if you're taking gap year, then it really opens up. You can take it whenever, and I think the scores are good for something like 3 years. Hoping on that. But they're good for a certain period of time, so you should just take it whenever you feel comfortable.
And it's because like med schools are rolling, right? So
right.
That means,
right. Okay. Almost all med schools are rolling, and
so it's like sort of like a first come.
It is very much a first come first serve. I think I've seen some very strong candidates with excellent GPAs, MCATs, extracurriculars, not get into med school because they applied 2 months late. And that's just, it's really unfortunate, but it's the nature of the game. You have to apply early. Within the first month of the application opening is my recommendation. Sooner better than later.
In terms of actually studying, what did you find the most helpful? Because for a lot of times this isn't, it's like a exam that they've never had to, most students never had to take. It's in terms of the breadth of knowledge that they have to know, it's a lot. So how did you go about it? Is there anything that you would sort of recommend to other students?
So I got one of those generic review book series. I can't remember if I used Kaplan or not, but it was like a 5-book thing, like small review books with kind of the information that you need to know and some practice questions. And I went through them pretty quickly, but really where you want to spend the most of your time on, I spent probably 75% of my time on, is doing practice questions. So you want to find yourself a question bank in a good one, whether that's old tests, and I definitely recommend you take at least 1 or 2 old tests, or an organization that provides you with those questions, with practice questions. The way that people get better at taking standardized tests is doing questions. It's not reading and rereading the same information. Because you'll absorb as much as you can absorb on one pass. You won't absorb that much more reading a textbook again. Where you really do your learning is doing practice questions. And that remains true for med school as well. Step 1 is the same way. So more important than anything else, do as many practice questions as you can get your hands on, and read the answers. That's how you get good at it, and that's the truth. I know some people take a review course. I didn't. I would recommend it if you think you're going to have trouble with self-discipline.
Just sort of keep you on track.
It will keep you on track. I think a lot of them have been shown to be pretty effective. But with that said, if you feel that you can keep yourself organized, making a calendar of by the end of set a test date. Okay, it's my test date. I have 8 weeks before I take my test. First week I want to read this section and do this many questions, and you keep yourself organized that way. You're going to do just as well and save about $2,000. However much it costs, I don't know.
going off the MCAT, another big part of the application obviously is your extracurriculars. What would you say is certain extracurriculars that are important to do in order to help like your chances of getting to med school? And also extracurriculars that you would say that are not necessarily like pre-med, like research or like voluntary like that. Just like stuff that what do you sort of like recommend to that?
Yeah, that's a tough question. So formally or informally, most med schools want to see some evidence of clinical experience. That can be in the form of volunteering, let's say in a hospital or an office setting. That can be in the form of working as a paramedic. Maybe you're a phlebotomist. Maybe you did. Maybe you were a scribe for an emergency room or something like that. But some form of clinical experience is necessary for med school. It's better to do it over the course of a year or two rather than try to pack it in 2 months before you apply. Because it kind of looks a certain way. And that's my opinion. That's not the schools or anybody. That's my own opinion from what I've heard. That I think a lot of people share that. So generally, evidence of a longitudinal interest in clinical experience. That's one thing. Number two, research is a big question mark. A lot of people have questions. Do I need research to get into med school? The answer is no, you don't. With a big but. You need research. You need some form of research, or at least a strong expressed interest in research, if you want to go to a school that's known to be a research institution. So as an example, Pitt has required research for all its med students. We all have to do a big project. Most of us do a summer project in between our first and second year as well. If you apply to a school like Pitt, they expect you to be interested in research, and most of them will expect you to have some experience in research. That doesn't mean you need publications. Most of us don't have publications going to med school. It's great if you do. I didn't. Most of my classmates didn't. The majority of my classmates didn't. So, it's good to have research if you're going to be applying to a research institution. If you have no interest in doing research, and you don't want to apply to a research institution, there's many schools that would be happy to take you without any research. But it's just something you need to figure out for yourself. I generally recommend people try at least a semester of it to see how it goes for them. I think it's interesting, and a lot of our modern medicine is ultimately based on research, so it's an important thing to have, in my opinion. What else? We talked about clinical experience, we talked about research. Shadowing, less important. I think you should do it because I think you should know what you're signing up for. If you want to be a doctor, you should know what a doctor does.
For sure.
How much shadowing hours? I personally don't really think is as important as having seen it and being familiar with different kinds of like physicians and what they do. Just for personal growth, I think it's important. A lot of schools will look for leadership, evidence of leadership, because physicians are ultimately the leaders of their medical team. And that can be done through any club, organization, anything you're passionate about. And generally, most pre-meds don't have too much of an issue with that. Most pre-meds are pretty type A, they like to be in control, and that's not a bad thing. But I would say the biggest, having said all that, when med schools invite applicants to interview, what the interviewers are really looking for is to see something that separates you from everyone else. Usually that means that they want to see that you're passionate about something in your application. Like something that you did that you can point to and you say, yeah, I'm proud of that, like I put a lot of time in that, I'm very passionate about the subject. That separates you, So whatever the rest of your extracurriculars look like, just you should really have one thing that you're proud of or that you're passionate about that separates you.
And does it necessarily have to be like med focused?
No, it doesn't. It absolutely does not. A lot of people are very interested in policy, and they've done they've gone to like conferences and done policy research. Some people. I remember one candidate talked to me about like cheese making for a really long time, and it was super interesting, and it was really cool, and he was really passionate about that. Like he set up this whole thing like in his room, like growing different cheeses. I'm like, that's neat. I've never heard of that. Now, some people may not think that's as cool as that, but you know, he had something that separated him, and despite the dozens of people I interviewed, clearly I remember that one very well. So you should have something about that. It doesn't have to be in the medical field at all.
So what part or moment you'd say your med school journey so far has had the biggest impact on you, or sort of really changed like your perspective about something, you'd say?
I would say by far the most meaningful aspect of med school has been my third year for me. And like I said, the third year is the one where you finally go into the hospital and you discover to a lesser degree what it means to be a physician, truly what it means to be a physician, seeing the face-to-face interactions and the difficult decisions being made. And I think the experiences that you have there end up shaping you more so than any book learning you do in med school, and kind of change your outlook for what it means to be a physician. And I think it's very meaningful for a lot of us that particular year. It's a big year of growth. You start to develop confidence. You develop problem-solving skills, and you learn a lot of the realities of medicine, which is that your best plan and your best medications may not always work for every patient because of either their choices, your choices, the hospital's ability to provide them, or costs. There's so many other issues going on. So I think it's just a very transformative year.
So in terms of research, I know you mentioned it, a lot of pre-med students, they sort of see research as just this like stepping stone to, because they just know that med school is like when students have research in the background. What would you say to those people who just view it as that stepping stone? Like, why do you think it's important to not just have research as a background, but to actually perform research if you're interested in the medical field?
I think it's important because even if you become a doctor that does absolutely no research in their career, which is probably the majority of doctors, you will be constantly reading, or you should be constantly reading and hearing about new updates in medicine. And those updates come in the form of typically journal articles, guidelines, research conferences, things like that. And it's valuable to be able to do research yourself, to be able to truly understand what it means to read and interpret scientific literature, because you'll have pharmaceutical companies come to your office and tell you about their product, and they'll show you a study. But I think it's difficult for someone who's never done research in their life, never thought about the problems of a research project, of a good clinical question, how to interpret those findings. And yeah, you can learn that a P less than 0.05 is good, P greater is like bad, but there's so much more that you need to think about, and I think it's very difficult to interpret those findings. Outside of that, I think it's important for physicians to just know what it means to do research for your own medical practice. I think that's an experience everyone should have. But I'm also interested in academic medicine, so maybe I'm biased. I'm sure that if you talk to other med students, maybe who don't go to Pitt or who go to other schools, they'll tell you differently. And it's not that they're invalid. It's just that's my personal belief that I think it helps to have a research background. If you're going to be involved in any kind of scientific field, which medicine is almost certainly a scientific field.